You're welcome back. You're still watching Newsnight. We're live from Abuja, Nigeria's capital city. The National Association of Resident Doctors, NARD, has announced that it will resume its total, indefinite, and complete strike from January 12, 2026. The association cited the federal government's failure to implement previously agreed upon terms outlined in a memorandum of understanding as a reason for the action. This was contained in a statement on X signed by NARD President Dr. Mohammed Suleiman following an emergency National Executive Council meeting held on Friday. The association warned that unless the demands are addressed, the country could experience another widespread disruption of medical services. The industrial action has been labeled "no implementation, no going back." And the national president of the Nigerian Association of Resident Doctors, Dr. Mohammed Usman Suleiman, joins me now on Newsnight for updates on the association's planned industrial action and to assess the level of government compliance with the terms agreed during the previous negotiations. Very warm welcome to Newsnight and thanks for your time.
Thank you for
coming. A lot of Nigerians will say this is one strike too many. Even your colleagues who became ministers, you know, medical doctors who were presidents of NARD, I could name a couple of them, embarked on this strike too, while, you know, they were still practicing. And when they became ministers and all these MOUs were laid before them, what's the problem?
Thank you for having me. Good evening to our viewers. It's unfortunate that we're here. We suspended our strike, I think, 27th of November. At least that was when we signed the MOU with the federal government. In that MOU, we agreed on all the 19 items. I can highlight a few for you here. For instance, on the Lokoja matter, the House of Reps got a petition from the constituency back in Lokoja and made a pronouncement that our colleagues be reinstated back to Lokoja. The Ministry of Health itself, during negotiations, set up a committee which recommended not only the reinstatement of our colleagues back to Lokoja, but also recommended the payment of their back pays, the pays they lost while they were out of work. To our greatest surprise, the Ministry of Health is advising us to ask our colleagues to apply to other places outside Lokoja. There are two problems with that. These are union leaders. I'm a union leader. If today, because of this agitation, I receive a query from my work...
Do you put unionism ahead of your primary assignment? Unionism is supposed to be second.
And unionism is protected by law in Nigeria.
Very well.
The Federal Ministry of Labour frowns at singling out union leaders and victimizing them. It is a constitutional right in Nigeria for you to associate, form unions to protect your welfare. The welfare, I might add, that even by the admission of the Federal Ministry of Health, there is over 40 million Nigerians that seek healthcare services in one of the quarters of last year, up from 10 million in the previous quarter. And it is health workers that will see these numbers. They are not AI, they are not computers. They are human beings. They have problems like debts. They can't pay school fees for their kids. They can't pay rent. They walk to their work now, and then when they get to their workplaces, they take calls the whole week, the whole month. There's a Dr. Halima in Internal Medicine Department in Federal Teaching Hospital, Gombe today that is on call from 1st of January till 31st of January. If we don't protect Dr. Halima, Nigeria has already let her out to dry, to take calls every day for 31 days. So back to my colleagues in Lokoja. If I am queried today, and I'm asked to leave my job in FTH Katsina, and a future NARD president comes to agitate, bring back Suleiman, BBS, the federal government, by what they have done with the Lokoja 5 now, will tell you, no, Suleiman, you can't go back to Katsina. We will take you somewhere else. And that is a deterrent. That is a slap. That is a legal conundrum to unionism and activism in Nigeria. It's totally unacceptable. Take, for instance, the issue of the professional allowance table. I had explained earlier that these are errors that happened way back from 2019. When the table was finally released a few weeks ago, it carried arrears for only 18 months. We tested it, we accepted it. That is what Nigeria can afford, and we're patriotic Nigerians. It was captured in that circular that all the arrears will be captured in 2026 budget. An implementation payment will start of that adjustment, of that correction. It's not an increase in salary. It's a correction of errors. Will start this January. As I'm talking to you here, that has not been captured in the budget presented before the National Assembly, which means a few months down the line, we'll still come back to make noise about this.
So it's the Ministry of Health that is playing politics over this bureaucracy?
I can confirm to you that the Ministry of Labor
Yeah.
has done its due diligence with respect to engaging NAD. The Office of the Head of Service has clarified the issue of the entry level, has clarified specialist allowance. The Minister of Finance and the Budget Office have assured us whenever our promotion areas and salary areas are computed by Ministry of Health and presented to them, they will give us a payment plan. So every facet and aspect of government has done the needful. And they have passed the bulk to Ministry of Health for implementation.
So why is Dr. Pate and his management team not doing that? Because that's what you're saying.
Well, I can confirm to you.
That is what you're
yes,
saying.
I can confirm to you that in Federal Neuropsychiatric Hospital Barnawa in Kaduna, in National Ear Care Center in Kaduna, in Federal Teaching Hospital Ido-Ekiti, in even Bauchi, I think a few weeks ago, they are still giving doctors COMMES 2 as entry point instead of COMMES 3. That is 120 to 150,000 naira less. I have been, after the suspension of the strike, I have been to every office, every ministry, every agency, either me or other national officers, to push on these issues. And what did we hear? Nothing. Nothing has been written in terms of, and we're not talking about payment of money now. We're talking about letters being pushed from one agency of government, Federal Ministry of Health, to, for instance, chief executives on the matter of entry-level skipping, or to Salaries and Wages Commission on the issue of the specialist allowance, or to the National Assembly and the Budget Office with respect to the professional allowance table, or to Ministry of Finance and the Budget Office with respect to promotion areas and salary areas. Remember, there are doctors that have worked for 20 months, have not gotten their salary areas. In FMC, over 4 to 9 months, they've not gotten salary. OAU, THC, up to 14 months. Benue State University Hospital have about 18 months. And I can go on and UUTH Uyo way back 2023.
So this is a federal issue, not a general national issue. It does not affect state hospitals. Is that the situation?
State hospitals have their own conundrums. I just mentioned Benue State University Hospital. I can mention Del Sud, Ogara. I can mention where some of our colleagues were asked to leave work for 1 month in Ekiti State University Hospital because something happened on a day in theater. So there are different things that has occurred in different places that is affecting our members. But let me emphasize a few things. Senior Nigerians, top government officials sat down with us and agreed and signed an MOU. And we were very hopeful. We convinced our members, let us suspend the strike. And then today it looks like, for instance, on locum and excess workload committees that were to be set up to bring up a guiding principle on how these things will be implemented going forward. The Ministry of Health is saying there is no money to set up these committees. So it's like the MOU was taken, people sat down over it and thought of ways to either alter what was in the MOU or outrightly not implement it or cause delays. For instance, even in Lokoja, a group of people came out after the Ministry of Health Committee has submitted this report. When it was clear, the cost is clear for our members to go back, they now wrote a petition. We can't train them. We can't work with them. They didn't say don't take them back to Lokoja, but they are creating issues. And, you know, a petition just came. We've been trying to get them back for over a year. A petition just came now. Within 2-3 days, is on the table of the minister. You know, so if you say politics is being played here, I mean, who am I to argue with your superior wisdom? For us, it is our job to agitate for our members, for the welfare of our members. And that is why I have used opportunities like this to call on the president of the country to declare a state of emergency, even if it is on the welfare of healthcare workers. Why? In 2024, just 2 years ago, 4,700 doctors left the shores of Nigeria. I'm waiting to see the end of January or the end of February to see what is the statistics for 2025, because the number is really going to be staggering. And then you have overworked, underappreciated, under-remunerated people that are being pushed to the wall. Naturally, they will leave. Additionally, the National Executive Council said we're going to go on peaceful protests within our hospital premises. Maybe because they remembered that one of the reasons why our members in Lokoja were sacked was because they engaged in what government called unauthorized protests. That is what is carried on their termination letters. Unauthorized protests. I mean, we live in Nigeria today where you protest terrible working conditions and it is stamped unauthorized, and then you're terminated for it. So there are a lot of issues. We gave the benefit of the doubt.
So the 19 MOU, none is being fully met.
Everything we agreed upon is either it is at the point of where we agreed, no movement has been made, or we have even gone back. For instance, on the membership certificate, we don't even know where that conversation stands as it is today. This is a professional recognition that I will do a posting, pay for these exams, write these exams, pass. Someone in Ghana will do the same thing, and he is recognized as a specialist. The same West African College. I am recognized as someone with an additional qualification. We don't even know where that issue is today. You know, so NEC has no choice.
Very, very depressing to hear.
It's unfortunate.
It's a minus for the health services in the country. I'm sure Mr. President and his advisors are watching, and probably
I really do hope so.
In its higher intervention.
Mr. President, come to the aid of resident doctors in Nigeria. They really need your help.
Thank you very much. Dr. Mohammed Usman Suleiman is the president of the National Association of Resident Doctors.